Coming to the etiology. So the common causes, as I have already told, of contracted pelvis is also the same as a cephalopelvic disproportion. But the thing here, we will not take the fetal causes into account, because contracted pelvis means सिर्फ pelvis का diameter कम हुआ है. So nutritional and environmental defects are number one. So it is rachitic pelvis or osteomalacic pelvis because of calcium and vitamin D deficiency. Then coming to, so basically rachitic pelvis is more than osteomalacic pelvis. Do you know why? Because rickets occurs in childhood. And childhood में अगर bones affect होता है, then the diameters will be changed more compared to if they are affected in adulthood. Osteomalacia occurs in adulthood. So adulthood में जब bones affect होता है, mostly the curvature of the bones are already formed. So there will be weak bones, but then the diameters will be proper. But if there is rickets, that is young age में, there is the bones are affected. In that case, what happens? Your pelvis, the diameters will also be affected in that case. Then there can be injury to the bones, like fracture tumors or tubercular arthritis can be there. Spines can also be affected as shown in the picture above. There can be kyphosis, scoliosis, coccygeal deformities, this you all know. Or there can be lower limb defects like in the form of poliomyelitis or hip joint diseases. Developmental defects can also be there. Naegele's and Robert's pelvis are very much examples. What is Naegele's pelvis? Naegele's pelvis is one of the ala of the sacrum, that is on one side, will be absent. So this is a developmental problem. And if both the sides ala of the sacrum are absent, then it is called a Robert's pelvis. Okay, both the sides ala of the sacrum are absent. Coming to classification. So there can be contracted pelvis can be classified depending upon the level of distortion or the pelvic architecture and the degree of contraction, the degree of contracted pelvis it is. Okay. Now coming to the classification by pelvic architecture. The first is pelvic equabiliter justo minor. So basically, what do you mean by equabiliter justo minor? It is a justo minor type of reduction. That is, the diameters of the pelvis are reduced just by borderline. So थोड़े थोड़े करके diameters reduce होंगे. It is called equabiliter justo minor. So basically, all the diameters are reduced by 1 to 2 centimeters. So occurs in short. Also occurs in women with massive skeletal bones and underdeveloped muscles. So what happens? Sometimes you will see that your consultants, they are telling कि patient का height छोटा है, patient has a short stature, and in short stature we will not give trial of labor, we will go for a direct cesarean section. So short stature patients generally have this type of pelvis, justo minor type of pelvis. This means all the diameters are reduced just by borderline 1 to 2 centimeters. And also there are the skeletal bones are also a minor bit underdeveloped. So the pelvis is masculine in feature with narrow sacrum, narrow pubic outlet, which is called a funnel shaped outlet. Okay. So these are the diameters. This is just a type of justo minor pelvis. See, all the diameters in the pelvis will be same. All the, the architecture of the pelvis will be same. It will look just like a normal pelvis, but the diameters will be just reduced by 1 to 2 centimeters. So that there is just a minor degree of cephalopelvic disproportion, which you will find in justo minor pelvis. Coming to the next one is a flat pelvis or a platypeloid pelvis. In platypeloid pelvis, we already know that platypeloid pelvis is transversely oval. It means the transverse diameter is more than the anteroposterior diameter, even at the inlet, even at the mid cavity, and also in the outlet. So when all the diameters are more in the transverse diameter compared to the anteroposterior diameter, then the fetal head will try to engage, but then rotation won't take place properly. And when internal rotation doesn't take place, then it becomes difficult for the head to come out. But if there is proper descent, अगर descent हो जाता है, then in that case there can be precipitate labor also in flat pelvis. So flat pelvis can be associated with number one, there can be difficulty in engagement. So there is cephalopelvic disproportion. But अगर engage हो जाता है, then there will be your this thing precipitate labor, जल्दी निकल भी जाएगा. So there is reduced anteroposterior diameter with normal transverse and oblique diameters in flat pelvis, and it has two types of contractures. One is simple flat or platypeloid pelvis. Here the entire sacral platform is dislocated towards the symphysis. Hence, all the anteroposterior diameters of the pelvic planes are reduced. It means the sacrum has come anteriorly. And when the sacrum has moved anteriorly, so the distance between the sacrum and the pubic symphysis has reduced. This is a flat pelvis, simple flat pelvis. Coming to a flat rachitic pelvis. So a flat rachitic pelvis is when the anteroposterior diameter of the pelvic inlet only is reduced. So only the only the pelvic inlet anteroposterior diameter is reduced. It means the true conjugate and obstetric conjugate and diagonal conjugate are reduced. So there is difficulty in engagement. But once the engagement has occurred, there will be a good progress of labor. This is basically due to rickets. Ricket generally affects the side walls and the ala of the sacrum. All those things are affected. Okay, so the anteroposterior diameter is reduced. Then comes the generally contracted pelvis, means all the diameters are more reduced. It means all the diameters are reduced by a severe amount. But the anteroposterior diameters are shortened greater compared to the transverse diameter. So basically your contracted pelvis में जो फंडा आपको याद रखना है वो है anteroposterior diameter is majorly reduced. So be it only anteroposterior diameter reduced or be it anteroposterior plus transverse diameter reduced, that is just a minor type of pelvis. All the things will lead to a contracted pelvis. So basically your anteroposterior diameter reduction will lead to a contracted pelvis. Okay.